Hello, everyone, and welcome to our March Member Cafe. Thank you for joining us today as we come to the end of our series, Healthy You series, where we're going to talk about diabetes and we're going to do some myth busting today with our panelists. I want to welcome you, and my name is Kelsey Disla, and I am the Member Engagement bilingual health educator with Partners Health, and I am part of the member engagement team. And again, thank you for joining us today. We are here with some folks helping us out today. I have Terry Christie, and she's going to be our producer today. So she's going to be in the background. If you have any technical support that you need, Terry's the one that you want to message. I also have Lindsay, who's going to help us with our Q&A. So we're going to encourage you from now that if you have any questions that you have, put them in the Q&A and we will make sure that we answer those before we close our time together. I also have Tim, and Timothy is going to be supporting Timothy Simmons, excuse me, is going to be supporting us with the chats. Again, I'm going to encourage you to participate and use the chat to communicate with us. We're not going to be looking at the chats, but Tim will let us know if you have anything that you're sharing that's corresponding with what we're going to talk about. I also want to introduce our panel today. I'm super happy to have them here with us. We first have Carly Wetmore, and she is an RD, LDN, and CDCES, manager of Atrium Stanley County Diabetes and Nutrition Center. And she is also a registered dietitian with about 11 years of experience and has served as a certified diabetes care and education specialist for the past 8 years. She also has been a proud Atrium Health teammate for about 8 years and currently serves as a manager of the Diabetes and Nutrition Center. Carly has a deep passion for helping people and patients achieve sustainable lifestyle changes related to nutrition and diabetes management. And she truly loves her career and she feels blessed to support patients and the community and work alongside her teammates um, who feel like to her as a part of her extended family. So, welcome, Carly. Thank you for being with us. I also have Brandy Lineberger with us, and she is the Director of Care Management Nurse Consultant Team here at Partners Health. And Brandy has been a part of Partners since 2012, and she is a registered nurse. She's a faith community nurse and a certified dementia practitioner. Brandy has worked in various areas as a nurse, including intensive care, home health, hospice, long-term care, geriatrics, and behavioral health. Brandy has a true passion for improving the quality of life of the members and our communities, and she has served as a member of the North Carolina Institute of Medicine Older Adults Task Force. She's been part of the Council on Aging and the NC Home and Community Block Grant Advisory Committee in the past. Brandy serves on many committees and work groups because she's dedicated to health promotion and prevention and improving the lives of the entire population. So anybody she comes into contact with. And last but not least, I have Tom Martin, our pharmacy board certified pharmacotherapy specialist, and she's certified, excuse me, board certified pharmacotherapy specialist and a certified diabetes educator. Excuse me, Tom. He currently serves as a clinical pharmacist with Partners Health Management. And Tom received his bachelor's of science and a doctorate degree in pharmacy from the University of North Carolina at Chapel Hill, the School of Pharmacy, and completed a postdoctorate residency at Wake Forest University Baptist Medical Center in Winston-Salem. He spent 12 years as a pharmaceutical care coordinator for critical care at Wake Forest University Baptist Medical Center before moving to the Carolinas Medical Center in Charlotte, North Carolina, where he spent 8 years as a pharmacy clinical specialist for critical care. And he serves as a clinical pharmacist for the Carolina Community Health Partnership Network of Community Care of North Carolina for 9 years before he came to be with us at Partners in 2021. So, welcome, Tom. Sorry, that is a lot of information already for you all. So, we're just grateful and happy to have you all. As we said before, this is the third part of our series, and we do have a little bit of housekeeping rules that we want to go over before we go ahead and get started with our myth busting. So we do offer today's session is going to be offering closed caption. You will see the controls for the feature at the bottom of your screen. Unfortunately, we are unable to accommodate AI note takers within Zoom due to cybersecurity reasons. So we will have to remove any attendees who are using AI or remove that feature. So please accept our apologies. I know a lot of people use the AI features, but it's just for security purpose. So we apologize for any inconvenience related to that. Also, as you already saw, this meeting is being recorded. So please do not share any personal information during our session in the chat nor in the Q&A. We want to protect your information, so please do not share those. Our partner staff is available for you individually if you have any issues or any concerns, anything you want to discuss. Outside of this, we welcome any of you to reach out to us, and we'll share more information on how to do that later on in our presentation. Again, this recording will also be in our website. So the recording will be available for you once we upload it in our website at www.partnersbhm.org. On the top right-hand side in the search bar, you can enter Member Cafe, and you will be able to pull up the video so you can watch it again. Please, we welcome you to use the chat. That's going to be open for engagement. Our Q&A feature as well to ask any questions. Our reaction features, which I love, they're on the bottom. Go ahead and give me a thumbs up or heart emoji if you are ready to roll with us. Awesome. And we will also have, I think we have two surveys towards the end of our presentation. We really want to hear from you. Your input and your feedback is super important for us to continue to bring subjects and things that are interesting to you. So make sure you fill out that survey. It doesn't take too long, so that way we can share more information that is relevant to you. Again, thank you for being with us. We're going to go ahead and get started. Everybody ready for myth busting? So our first question, I'm going to go ahead, I'm going to start with Tom, and we're going to talk about this myth. No one in my family has diabetes, so it's possible that I won't get it or I won't get it. It's something that I don't have to be worried about.
That's a good one to start with. I hear that a lot. People that find out they have it, like, where'd this come from? Nobody in my family's ever had it. And other people that don't have it, but everybody in their family has it. So they want to know why they don't. So, first, let me just say that diabetes is a very individualized disease. There's no one pattern that fits everybody, there's no predictor that fits everybody. Clearly, there are some things that you can measure and check, and hopefully your doctor does that, and you do that so that you'll know your risk. But diabetes is very heavily genetically linked. So, as I always say, if you have, the triad of high blood pressure, high cholesterol, high blood sugar, those kind of run together. You can blame your family for that more than probably your lifestyle.
Mm.
Your genetic code determines a lot of times what our maladies are going to be. But diabetes, especially, again, certainly genetics plays a role, but there are certainly health-wise, healthy things that we can do to try to prevent it at least. And that's why we
Mhm.
always encourage in the education field, we always encourage, an active lifestyle, um, eating better. And I know Carly can talk about this all afternoon, as we all could. When it comes down to food, everybody wants to know what can I eat, what can I not eat, all that. We'll touch on that some, I'm sure. But your diet certainly can play a role. Eating a lot of sugar doesn't give you diabetes. It can make it worse and can make it, make your sugars go up, certainly. But you can't give yourself diabetes by eating a lot of sugar. That's one of the biggest myths in diabetes is that I ate a lot of sugar as a kid, and now I have diabetes. But
Mhm.
we can talk more about that later. But that's the
Yeah.
biggest myth is that, it's not really even your lifestyle, but certainly the more active you are and the better you eat, you lessen your chances of having complications from diabetes, which is what it's really all about.
Awesome. Awesome. Thank you so much, Tom. Anybody else, Carly or Brandy, want to add to that?
Yeah, I like to say in our classes, diabetes doesn't discriminate. It can happen for anyone,
Mm.
regardless of, genetics definitely is a factor, but not the only factor, like what Tom was saying. So those lifestyle changes, larger body size, even age related, can be a
Mhm.
risk factor there for how much insulin that our body is able to produce. So, ethnicity, um,
Mhm.
having diabetes during pregnancy for women. So, I mean, there's so many different factors involved. And I think that's why it is hard for some to accept because it's like, there's so many reasons that could be behind it. It's hard to pinpoint just one. It could be several that applies to a patient. So, yeah, I think that can be very difficult to accept is,
Mhm.
why did I get this? Nobody else in my family did. And
Yeah.
sometimes I hear it, well, my cousin, they may be a larger body size and I'm a smaller body size, but I have diabetes and they don't. And I said,
Mhm.
well, they may not have it yet. They may have it eventually. You don't know. But it does.
Mhm.
It can happen really for anybody. Yeah.
So really, we shouldn't just lump sum ourselves into anything. We're all individually created, and that can be the same for this particular topic or this disease. Thank you so much. Awesome. All right, we're going to keep myth busting because we have a lot of them, and we want to get to all of them in this hour that we have together. So I'm going to ask, since Carly, you were talking anyways, I'll ask you the next one. I will likely develop diabetes because I am overweight. Or some people might say that, if you're skinny or eating healthy and you're a healthy weight, that you're not going to develop diabetes. So two opposite sides of one coin, right? So tell
Yeah.
me more about that.
Yeah, and I think like what we're saying with those risk factors is that body size and BMI and all of that can be a risk factor for diabetes, but also I think about age-related, ethnicity, how much activity that we are participating in, and then along with our food choices as well can really impact those blood sugar levels, and how well our pancreas is working.
Mm.
And so for the pancreas, that is the organ that produces insulin for our body. And if we're not having enough of that insulin to be produced, we're having those higher blood sugars. And that can happen whether we're, smaller size or larger size. With one factor that can happen is insulin resistance. I know that word gets tossed around a lot on commercials and such, and a larger body size can place us at that increased risk because it's preventing our body from using the insulin as well as a
Mhm.
smaller size. But regardless, that diabetes risk is still there for anyone, regardless of body size.
Awesome. Awesome. Great. Thank you. Anybody else want to add anything to that one? We're good. The experts have spoken. We're going to continue to go with the next one. Brandy, this one's for you. Um, I love this one because, we a lot of us eat sugar, right? We eat sugar and we're like, uh-oh, now I'm worried I'm going to get diabetes because I'm eating a lot of sugar. Or even with our kiddos, right? We're like, hey, too much sugar, be careful. Tell us a little bit more about that. Eating too much sugar, Should I be worried about getting diabetes, or what should we think about when it relates to that?
So the amount of sugar that a person consumes really doesn't have anything to do with the actual development of the diabetes. It is more of not controlling, that amount of sugar that you eat and how
Mm.
it does affect you if you do develop diabetes. So that's when it becomes really important. Um, you cannot just say that eating too much sugar alone is what will be a predictor that you'll develop diabetes as
Mhm.
you get older. It certainly can increase your weight. It certainly can increase your BMI, like Carly and Tom were talking about, and it can
Mhm.
definitely put you more at risk. But
Mm.
we have to remember it again is not just the amount of sugar that you eat, it's environmental factors, it's genetics, it's a whole combination of factors that lead to or can increase the risk of developing diabetes.
Awesome, awesome. And on the adverse side of that, right? Now I have diabetes. Now I can never eat a sweet. What do you say about that?
Not
Since you're on the
true.
topic.
Yeah, absolutely not true. Now, what I will say is it's really, really, and I mean, I think it's fun to create meals in a
Mhm.
way that can make it more enjoyable for you,
Right.
that could mimic other foods. So, for example, some people might choose to have mashed potatoes. There's a couple of different things you could do to reduce the carb load that you're going to have or the amount of carbohydrates that you're intaking. And so one
Mhm.
way to do that could be possibly to choose like a mashed cauliflower. And so it's a really good sort of sneak substitute.
Right.
I really do like that. Another thing that you can do is you could have sweet potatoes. And so
Mm.
I do that a lot. Sweet potatoes have a high fiber content, so it sort of slows down the absorption. I like to add a little bit of cinnamon to my sweet potatoes.
Mm.
Some people add brown sugar. I do not add brown sugar.
Mhm.
If I did, I would probably choose a very minimal amount and not have other carbs at that same time. So it doesn't mean that you can't have sugar. It doesn't mean you can't have a treat. You just have to do it within balance. And you have to make sure that that plate that you're planning, your healthy plate, is a balanced amount of fats, proteins, and carbohydrates.
Awesome, awesome. Anybody
Carly
else want
probably
to add
wants to jump
anything?
in. She's
Yeah,
our
yeah.
I
she's
do.
our
Well,
expert in the
yeah.
dietary area.
Yes.
Yes.
Brandy, you had some great tips on that, and that's excellent. That's what we try and teach in our diabetes classes is
Yeah.
finding those substitutes. And I always like to tell patients when they come in, because that's always their point of hesitation. I'm going to go see the dietitian. She's going to tell me I can't eat anything, and I tell them I would never tell you that. I always try and find a way to incorporate it into your plan,
Hmm.
because there's foods that I've had patients say I will never give this up, and I don't want you to have to give it up. It just might be, can we have it in a smaller portion? Could we have it as a treat? So on an occasion versus an everyday kind of option. And I think finding those substitutes to really help patients to say, oh, I do enjoy that. I can have that food. I can still go to my family Thanksgiving meal and bring the mashed potatoes, but part of it's cauliflower and nobody knows. And it's still helping my blood sugar. So being able to find those substitutes and work with a patient, like Tom said, diabetes is so individualized and everybody has their, I'm going to eat this food and I'm not giving it up. And so there's always some kind of food like that for a patient and being able to work that into their plan. And that gives them the balance. Like what Brandy was saying with the plate, trying to find, a fourth of the plate to be those carbohydrate foods that break down into sugar, a fourth of the plate to be protein. So maybe a meat or a plant based option that does not break down into as much of that sugar or carbohydrates, and half of the plate vegetables. So we try and tell patients it's all about that balance, and you can still have a full plate of food at your meals and be satisfied. It's just working on those choices that we have to make with it. Absolutely.
I love that topic. It reminds me of, my daddy got diabetes when we were still young. And I remember we all went on a diet just to make sure dad ate the right foods, right? So that um, just incorporation of family and also the support alongside with that. And you kind of debunked our other myth that was talking about, I was told to have diabetes and now I have to eat a special diet. So I love how you guys are mentioning that moderation is important and it looks different for everybody depending on, things that you like or don't like, and you want to incorporate different things so that way you make it fun. I remember it was a tragedy, a tragic thing. Like nobody ate salt, nobody ate, but that was back in the day. So things have progressed so much when it comes to nutrition and how to really balance that out. So awesome, awesome. Anybody else want to add anything in
I just
reference
want
to
to, yeah, I just want to say one thing personally about that because I've been there where you just described. My
that?
wife
Uh-huh.
got diagnosed with type 1 diabetes when she was pregnant,
Mm,
which is kind of odd. Typically, you get gestational diabetes, but hers
right.
turned out to be type 1. And my son is 33, so we've played the diabetes game at home for 33 years, which is why I'm bald headed. You see, we find out a lot of things you don't say to your spouse who's pregnant and has newly diagnosed diabetes.
That part.
I said all the wrong things, but that's one reason I
Right.
got into diabetes education was I was going to fix her, right? I was going to read all the
Mm,
books, learn all the smarts, tell her what to
mm-hmm,
do.
mm-hmm.
I didn't last too long, but anyway, my point of bringing her up is Carly shaking her head. No, you don't talk to your spouse about this. But
Rules to
one
live
thing
by.
that we both learned together was we cleaned out the cupboard just like you said, threw away everything that
Hmm.
looked white. You know, they tell you don't eat anything white.
Right.
So we threw out everything that we liked, which left us nothing. We started buying stuff they told us to buy. And it's, back then, this was 30 years ago. The taste
Right.
just wasn't there yet. It was
Hmm.
nasty. Other
Yep.
than, the way they have come through the years, a lot of the stuff now is a lot better. But the point that I'm
Hmm.
trying to make, and I always use this in my diabetes classes or whenever I'm talking to somebody, is we're going to end up eating what we like. Bottom line is you may change your diet a little bit, especially if you're just finding out you have diabetes and you really want to do the right thing. You try new
Hmm.
stuff, and maybe you'll find, the cauliflower stuff is legit. You can get cauliflower pizza. They use cauliflower to make the crust. You won't
Yep.
know the difference. Jill makes cauliflower noodles for spaghetti, those kind of things, or they sell them. But anyway, what we found out was we're better at eating less of what we like, and that was what I was going to
Hmm.
chime in here is we just eat smaller portions. And I know Carly wants to bring out her plate and show you what a portion size looks like and the little
Yeah.
plastic pork chop and all that stuff that we use in teaching. But
Yep.
the bottom line is you just eat less of what you like. Cut everything in half. My golden rule is cut everything in half and take the other half home with you, eat it later. But it really is about
Awesome.
retraining how we eat, what we eat, the volume of stuff that we eat, not necessarily changing the stuff, making you eat stuff you don't like, because you're not going to do that very long.
Right, right. And that is very important as it pertains to finding that balance, right? Um, to the plate note, though, we did do we started the Healthy You series with the nutrition session. So if you want to check out the My Plate information, you go back to our website. You'll be able to find some more information about plate and portions, and myplate.com is a good resource as well to get some information around that. Hey, I also want to encourage you while we're on this myth busting topic. If there's anything that you want to that you're questioning and you want to see if you have the correct answer or not, please put that in the chat. Tell us what myth you want us to bust while we're here with you as we continue to talk about diabetes and what's true and what's not true. All right, so we're going to keep going. I'm going to go ahead and pick you, Tom, again. And um, one of the myths that we have is my provider put me on insulin. Now this means that I'm not doing a good job managing my blood sugar. Is that true?
Oh,
If
that's
I'm put in
false.
insulin?
That's false. This reminds me of the old Hollywood Squares game. If you're old enough to remember Hollywood
Yeah,
Squares, but
yeah,
that would be
yeah.
a big X. That's not true. But we do tend to look around us and we see what other people are doing. If somebody's on pills and I'm on insulin, then I feel like maybe I'm sicker than they are because I have to take a
Right.
shot. They get to take pills. This other person's doctor told them to exercise more. But you really can't compare across people because it's so individualized, as we mentioned
Right.
before. And if you're starting insulin or having to go up on your insulin doses, doesn't even mean that you're getting sicker. It's just a way to get your blood sugar under better control.
Right.
I guess the golden key here is the A1C, the hemoglobin A1C, which you probably all have heard of. That's kind of the number that helps us know how your blood sugar's been for 3 to 4 months on
Mm-hmm.
average. And you're going to have days where you're higher, your spike higher because you ate pizza or something very carby. And then you'll have days where you're doing better in terms of managing your sugars, and those days happen. Um, but the bottom line is the amount of insulin that you have to take may be a reflection of what's going on in your body. In type 2 diabetes, typically, if we measure your insulin level early in your diagnosis, around the time you're diagnosed, and even before, your insulin amount in your body is higher than it's ever been. Your pancreas is making more than it's ever made. The thing that starts that process is called insulin resistance.
Mm-hmm.
And that's where the genetic factor comes in. Some people are prone to insulin resistance, where the body just doesn't respond to the insulin that your pancreas has been making through all the years. And as we get older, that can happen. But as that happens, you may need more insulin to keep your blood sugar under the same amount of control. In type 1 diabetes, it's a matter of your pancreas doesn't make insulin. So you have to put back in what's not there at all. It's not
Mm-hmm.
really a matter of resistance. So again, everybody's different. Please don't compare yourself to anybody. And I've worked with twins before. I have twins myself. We adopted twins when they were 4 months old. That at this point don't have diabetes. They both have elevated A1Cs.
Mm-hmm.
But I can look at their birth mom and I can look at their body habitus. They're 25 and they're just bigger kids. Just genetically speaking, they're bigger kids and they're African American, so that puts them at a higher risk
Right.
from that standpoint. So it's really hard to compare across people and say, well, if you're on insulin, more insulin, you're sicker. And that's definitely not the case. That's a myth by far, but for sure.
Awesome, awesome. And while we're on that topic, and I'll go to Brandy, some people might think, well, hey, I know that I have diabetes and I'm keeping my diabetes medicine on check. And once my blood sugar is under control, then I can stop that. I can stop that medication or I can stop that medicine or anything that I'm taking.
Myth.
What do you have to say about that?
Go get him, Randy. Go get him.
Randy's like, no.
That's a good one.
Oh, yeah, let's don't do that. Yeah, so once you have worked with your physician and the dietitian and the nurse and your whole care team, and you have things where it needs to be, and you've got your A1C to an appropriate level, and you know how many carbs you need to be eating, and you know how much protein, and you have your medicine, don't stop. You got to keep going.
Mm-hmm.
It's like this is not a sprint, it's a marathon. So
Mm-hmm.
we have to stay in the race. We have to keep at it because, and there may be tweaks along the way that we have to make. So
Mm-hmm.
there may be adjustments that have to be made to the plan as we go. Um, Also, something that Tom made me think about, we have to consider that there are so many factors that do affect how your blood sugar changes, and stress can be a big factor.
Good one.
It can certainly impact the blood sugar. So, it may not be that you're necessarily doing anything wrong. It
Mm-hmm.
just might be how your body is responding or not responding. So, yeah, it's a marathon. It's a race.
Yeah.
Like we
And I
gotta
think
keep
we're
in
all,
it.
yeah, we're definitely all famous to, oh, I'm better now. So
Yeah.
I'm good to
I'll
go.
just
I can
add,
Yeah, I
rock
call that
this.
the old timey penicillin theory, because like back in the day, everybody used to think, oh, I take, 7 days of penicillin, I'm good, I don't have to take it anymore. Well, not all medications are like that, right? So you have to stick to it, stick to the plan.
Right,
yeah,
right.
and I'll just add on to what Brandy's saying and say
Mm-hmm.
this, that we see patients that get involved in diabetes classes and change their lifestyle to the extent where they're more active, they're eating less, eating better, smarter, and they lose some weight and their insulin requirements come down, so they
Mm-hmm.
don't have to take as much. And as I like to say, the amount of insulin your body needs oftentimes depends on how much of you there is, if you know what
Right.
I'm saying. If there's less of you,
Yeah, yeah.
if there's less of you, then your body may need less insulin. So as you lose weight, as you get more tone, it's not just weight, it's also fat cells versus muscle cells and lean cells versus fat cells. So there's a lot that goes into it. But if there's less of you, then your body requires less insulin, and your body might be making enough insulin to cover that. And so then therefore you wouldn't have to supplement it with insulin shots. But again, every person's different, and it's easy to get frustrated when things aren't moving the way you want them to move. So it is a daily thing to do the right thing, do the next right thing.
Yeah, and those side effects or anything like that are just based on what portions we need of medicine versus food, and what Brandy was saying, like finding the right recipe for each person, if you will.
Yeah.
Carly, you wanted to say something. I see you come off mute.
Yeah, I was going to say too, for patients, whenever we talk about that in the classes, I can't tell you how many patients said, "Oh, I stopped my diabetes medicine or all my medicine for over a year." And I'm like, "Well, what happened during that time?" They said, "Well, I had a heart attack or a stroke." So, with the medication, we're usually on them for a reason. So if you're having concerns about your medication or you're having some side effects, tell your provider, talk with them, right? Or if you're working with a PharmD, tell your pharmacist, because they don't know, right? We're just thinking that, oh, you're taking your medicine, and then not realizing that the patient has stopped. So definitely talk to your provider. Don't just stop your medications. Tell them what's going on if you're having concerns of side effects, because we've seen the ultimate side effects to happen of patients that have stopped their medications. Absolutely.
Right, right. And that takes us to the next myth that we wanted to touch on. Hey, I have borderline diabetes, so I don't need to worry about anything, any medicine, anything at all, because I'm just there. Right before it's really bad. So that pre-diabetes part, I would say. So tell us more about that, how we have to kind of be mindful of that, Carly.
Yeah, with the prediabetes. So that's saying your A1C, that's that average blood sugar over 3 months or 90 days, is between 5.7 and 6.4. So I like to say this is the time that let's make changes and try and prevent it going in from diabetes if at all possible. And this is a great time to do that, to work on those lifestyle changes. I believe the latest stats, it was like 1 in 3 Americans have prediabetes. 1 in 3. And at least 80% of those patients don't even know that they have prediabetes. So being able to, first of all, determine that, hey, I'm in this prediabetes range, and then secondly, say, I can make some lifestyle changes. I can work on my intentional movement to get more of that exercise. Sometimes I don't like to use the word exercise for patients because that has a negative side effect to it. Right. So even some intentional movement with them. And then working on those food choices, like what Tom said, eat what you love, but just try and eat smaller portions with it, right? Try and get some vegetables and fruits in there if we can. Drink your water, right? Just those things can make such an impact on a patient that it may have them come, to reduce their A1C, even bring it back to a more of a normal A1C, and really try and prevent going into that diabetes level if at all possible. And sometimes medications are prescribed at this time too to help the patient with that. Again, that's that individualized approach for everyone.
Anyone else want to add to that?
I just say make sure that you're using and forming a partnership with your care team, like Carly was saying, is so important to make sure you utilize your resources. So, it's a whole team approach. So if you have a nurse on your care team, you have a care manager, you have a dietitian, a pharmacist, make sure you're asking them and getting their help.
Right. Don't do it by yourself for sure. Awesome. And Brandy, I'm going to ask you about, since Carly was mentioning it, exercise. There's another myth out there, right? It's not safe to exercise with diabetes.
That's also something that's super individualized. So it's something that the person would want to discuss with their healthcare provider. Almost all people are encouraged to have some, like Carly said, intentional extra movement. So you want to add a little bit of extra movement. So definitely it's important to work with your care team, work with your provider, and determine what type of, and I'm going to go ahead and say exercise routine might be right for you. And with that word routine, I think that's also important. So it's important that they form a very scheduled type exercise routine, it's important that, they set those goals and that they work towards those on a daily basis.
Awesome, awesome. Anyone else want to talk about exercise?
I
I'll,
was
Awesome.
I'll
with
just say that
exercise.
it is a nasty
Go
word,
ahead.
but it's when we think of exercise, we think of lifting weights and running marathons and things like that. But what we're talking about here is just daily movement. It's literally like
Right.
walking to the mailbox to get the mail. It's chair exercise. A lot of people have bad joints, bad knees, bad backs, bad hips, and
Mm-hmm.
can't do those things. I mean, walking is a great one, but if it's painful to walk or if you have bad knees or hips, just please understand that any kind of movement, again, chair exercises, there are whole books written about exercises you can do in a chair. Anything that gets your muscles moving and more active helps your body use that blood sugar that's there and helps your insulin that's there work better. So any movement matters.
Awesome, awesome.
And I think
And
start small with that too. We had a patient, it's one of my best examples I can think of. She was short of breath walking from her vehicle into our classroom. And we're not in
mm,
a parking deck, it's just kind of, one level here. And what she was able to accomplish with her exercise was a goal of 2 minutes at a time. And so that's what she had set was 2 minutes. Then she worked up to 5 minutes and 7 minutes. I think sometimes we're like, oh, to make it count, I've got to exercise for 30 minutes or an hour and I got to go to the gym. No, start somewhere small that I can work on this. This is where I feel my best. And then I can always work on increasing that time or going up on that time for my exercise. So start small with it.
mm-hmm.
Mhm.
Awesome, awesome. All right. Well, I'm gonna ask this one off the cuff here. Um, do only adults get diabetes? Or the myth is, hey, only adults and only if you're a certain age. Tom was talking about uh, head, shoulders, knees, and toes hurting and not
Yeah,
working appropriately. So
exactly.
automatically you go to that person's old, but tell me about age and how that factors in sometimes with diabetes.
Well, I'll start and then y'all can chime in. But so obviously we have kids that are born with diabetes. So type 1, as I mentioned before, is kind of an autoimmune disorder where the body attacks the pancreas in utero, actually. And so kids are born with their pancreas not working, their blood sugars go up immediately. And
Mm,
then when I worked at Baptist in the neonatal ICU, we would see that a good bit. So the answer to that question is kids, babies, newborns can have diabetes.
mhm,
Typically, that age is going to be type 1. Um, and, back when I first started training 30 years ago, a lot of things have changed because we used to could categorize people. If you were older than 40 and you got diabetes, that was type 2. Younger than 40, typically it
mhm,
was either type 1 or a variant of that. Type 1, again, is where your pancreas is not making enough insulin. Type 2 is where your muscles have become more resistant to insulin that may be there. It just doesn't respond as well, so it doesn't control your blood sugar. The other player organ in this is your liver. You don't hear much about your liver in terms of diabetes, but it actually serves as the big sugar warehouse, the glucose warehouse that stores extra sugar when you eat, say, a carbohydrate, and you don't need to burn it right now for energy. Your liver stores that for you for future use. And so you normally live in this balance of your blood sugar being, say, 70 to 110, where your pancreas, your liver, and your muscles all agree to keep your blood sugar in that nice tight range. So as your blood sugar starts to fall, your liver lets sugar out to bring it back up, and as your sugar starts to rise, your liver goes into storage mode and stores that extra sugar, and that's insulin driven as well.
mm.
So type 2 is more of a dysfunction with that process where the liver lets sugar out when you don't need it. Those of you that are frustrated because you say, I just had lettuce for lunch and my sugar went up, it's not really what you're eating. It's just your liver's letting sugar out when you don't need to. But
Right.
that dynamic's a lot different than, say, the type 1 situation where it's just not enough insulin around. I think the concerning factor as far as age goes for me now is we're seeing kids that are 10, 12 years old being diagnosed with type 2 diabetes, which again, the old name for that was adult onset diabetes.
Mhm, mhm,
And the reason we know it's type 2, not type 1, is because we measure the insulin level in these kids and it's really high. So they're making insulin. It's not a pancreas problem. It's a resistance problem. And they are overweight. If you look at us as American population compared to what we were
mhm.
30 years ago, overall, we're all bigger.
Mm-hmm.
So a lot of the endocrinologists that I talk to or deal with refuse to say we have a diabetes problem. They say we have an obesity problem, and the obesity is
Mm-hmm.
driving the high sugars, and seeing kids 12 years old that are big enough to have type 2 diabetes, for instance. And of course, genes do play a role in that, but being overweight
Right.
has a role as well. So it's really hard to say age-wise, but long-winded answer to the question, but absolutely kids can have diabetes just like adults, and it may be a different type. We actually have 5 different types of diabetes now, depending on what's going on with your body.
Mm-hmm.
So it's very important that you get to a prescriber or get to a doctor, get diagnosed, and then get into a program that help you sort out what's best for you.
Yeah, yeah. And that reminds me of our second Healthy You series session in February. We were talking about those wellness checkups and how important they were because that prevention that happens during the time that you see your doctor and you see your nurse practitioner and whoever else you're talking with for your health, and the importance of having that prevention or preventative care, if you will, happen. So we can pick up on some of these things that might come up. I know as a mom, my youngest, he comes from big men jeans, not Levi's, no. But
Mhm.
but yeah, so I have to be more mindful, right? That what's the balance between hey, this is normal, he's gonna be six something, and hey, I have to be careful because nutrition is a factor that I have to be watchful for them. So great point. Anybody else want to add to that? Alrighty, so we're going to keep going. We have a few more myths that we want to debunk. I think this one is super important because we talk about maybe people being a little bit more prone to certain things than others. So the myth is people with diabetes are more likely to get colds and other illnesses. And I'll say, Brandy, what do you have to say about that?
I would actually say that is most of the time true. The immune system is on guard and it doesn't always function as well when you have diabetes. So that's why it's really, really important. I'm going to stick a plug in here for annual immunizations and vaccinations.
Mm-hmm,
Really
mm-hmm.
important to have your annual wellness visits.
Yeah.
It's important to follow up with your physician and see if there's any recommended age appropriate screenings.
Mm-hmm.
All those things are so important because, again, diabetes can affect your whole health. So,
Right.
yeah, definitely.
Wow, yeah. Anybody else wanted to chime in for that one? Awesome. Well, we're doing great here. Now, we all love them sugar drinks. So, one myth is do sugary drinks, going back to when we were talking about sweets and all of that, do they cause diabetes? When I have those sugary drinks like sweet tea down here in the South, or fruit punch or fruit drinks. What does that look like? And I will go to Carly for that one.
Sure. Yeah. So I think like what we've spoken about with it's not necessarily that the sugar is causing the diabetes, but it can lead to extra calories we're taking in. And again, that storage factor. So with having larger body size is a risk for developing diabetes. So kind of not directly, but can still impact that risk of developing diabetes. And I love to talk about the sugary drinks because I have that for so many of my patients. We talk about the regular soda and the sweet tea.
Mm-hmm.
And again, I have some that say, I'm never going to give those up. I'm not changing to diet. And I said, okay. Again, frequency. How often are we drinking these drinks? Can we have
Mm-hmm.
smaller portion? What are those other alternatives? I like to tell patients too, whenever we think about a can of Coca-Cola, that's about the same amount of carbohydrates as what could be in an entire meal. And you
Mm-hmm.
think about what's going to sustain you longer would be a full meal versus just having that one soda. But we do try and help patients to understand some of those alternatives, like with a diet soda or a diet juice or unsweet tea with a sweetener. There are stevia and monk fruit for those that are not interested in the other artificial sweeteners like Splenda, Sweet and Low, and Equal. So monk fruit and stevia are two that patients have been gravitating more towards, since they can be considered more of an alternative sweetener than just a completely artificial sweetener. I always tell the patient it's their choice. If they try it, they may realize I can enjoy this and still have my Diet Coke with a pack of Lance crackers, that I'm having for a snack. Pack of nabs is what we're told. And other times patients just don't like those diet sodas, and that's okay too. Always encourage water.
Mm-hmm.
I
Mm-hmm.
like to think of, if we're going from regular soda, can we have a stepping stone of maybe a diet soda or an alternative? And then ultimately, let's get to that water. That's what we need to hydrate our bodies. When we are staying hydrated, that can actually help our blood sugars to be lower, and especially for that kidney health, for filtration as well, trying to stay hydrated. But I guess it really depends on the patient and, what their choices are and what their preferences are, in order to change from those sugary drinks if we can.
Awesome, awesome.
Yeah.
All right, and that leads me to the next one, and I'll ask Tom this one. A fasting blood glucose sugar level of 100 is too low. Um, what do you think about that?
Again, hard to say. It's well, I guess I would kind of flip it around and just remind people that if your blood sugar, if you've never been told you have diabetes, and you were to check your sugar and you had a random blood sugar of 130 or 140 even after eating a meal, that doesn't mean you have diabetes. The
Mm,
definitions of diabetes, there are three basic ones. One is a fasting above 126, an A1C above 6.5. And the third one is basically a test where they give you a load of glucose and they measure it. Nobody really does that unless you're being tested while you're pregnant. They
right.
do it. They do it there. But
Ugh, I
yeah,
remember.
for those of you that have had did you have the nasty cola flavored one or the nasty orange
Yeah,
flavored one?
yeah.
They're very
First one,
nasty.
yeah, it was like
Yeah.
Pepto-Bismol slash some, I
Uh,
don't know.
and then you got to sit around and do nothing for a while, for like an hour, 2 hours. But
Mhm.
anyway, the point of that being that a blood sugar of 100 at any point in time may or may not be a problem. Typically, 100 is fine. 70 to 110 is considered what's a normal blood sugar in somebody who's not eaten for 8 to 10 hours, something like that. When we say fasting, we mean you haven't eaten for at least 8 hours. And so a lot of times those will be done first thing in the morning. If you sleep all night and you don't eat in the middle of the night or snack in the middle of the night, you can do a check first thing in the morning. And as long as that's below 126, that's typically what most providers will shoot for. But again, if you ate a big meal and you check it and it's only 100, 110, nothing to be alarmed about.
Got it, got it. All right. Anybody else want to chime in for that
Well,
one?
let me add one thing I just thought about. My wife always
Okay.
comes in my mind because she was so different about everything. But for those of you that had diabetes for a while, say maybe you live in the 200 range. Um,
Mm,
Jill unfortunately got to where 300 was a normal sugar for her. We had young kids and she was stressed
mm,
about that. She was home with them and was worried about having complications. So she allowed her sugar to run high for years. So 300 became kind of her normal. If she got below, 250, 200 in that range, she felt shaky, clammy, confused, just like somebody that
mhm,
would have a low blood sugar, say, of 60.
mhm,
So
mhm.
and that's what our body does. It resets. So the longer you
Right.
stay with an elevated sugar, your numbers move. So you're going to feel low, let's say at a 200 or a 150. So
Mm,
a blood sugar of 100 in somebody, and they're having symptoms of low sugar, the sweaty, clammy, confused, those kind of symptoms, you need to be really tuned into your body. But a person who's having those symptoms at 100, that can be a problem.
right, right. Awesome, awesome point. All right, we're going to switch gears. I'm going to go to Brandy, and we're going to talk about something that's coming up because we have spring springing up. Now we want to wear sandals and good stuff like that, right? We want to be comfortable for the season. The myth is, it's not safe for people with diabetes to wear flip-flops, or we got to put on all this lotion in our feet, especially in between our toes. So tell us more about that. Like, what does that look like for somebody who um, does have to be aware of what to do, what not to do.
So, skincare, first of all, skincare is so, so important to anyone who has diabetes or even pre-diabetes. It's really, really important to make sure you're taking care of your extremities. So, checking feet routinely. When I say routinely, I mean every day to make sure that there's not areas of redness, to make sure the shoes are not rubbing your feet, to make sure there's no blisters, there's no sores. And if there is, what do we do? So we have to call our primary care physician, get in to see them, and let them look at it. On that note, if you have diabetes and you're seeing your PCP, they should be regularly looking at your feet. They should be
Mm.
checking those out. That's very, very important. They should be making sure, just like you are, that there's no redness, there's no irritation, and that your feet look well. So on the flip-flop sandals, I encourage people not to do that, even people that are not diabetic, because, when you're outside and you're walking about, if you're going to be in the yard, it's really important to wear something that's closed-toed that's protective to protect your feet. If you're just lounging on the couch, probably okay. You can go for it as long as you're not wearing any shoes that are, again, rubbing, putting pressure areas on your feet, things like that. And moisturizer. So you were talking about lotion, Kelsey, and putting lotion on the feet. It's really important that
Vaseline.
yeah. So it's important makes Carly cringe, me too. So, yeah, so it's really important that you use the moisturizer that is recommended by your physician. And that's usually going to be a water-based moisturizer. So it's going to be one that's not scented. And it would be really important to not put that between your toes. We do not want to promote areas of prolonged moisture because what
Mm.
can happen is you can develop a fungal foot
Mhm.
infection. And
Mhm.
so you can literally get what people call athlete's feet. And so,
Mm.
we don't want to do that. So we want to make sure. And on that note, as they're checking their feet, and y'all know I'm a nurse, so I have to go there, make sure you're looking between your toes. And what if you can't get down there to look at your feet? It's okay too. There's mirrors. So you can use a mirror. You can put a mirror, on the couch or on the floor and use your foot to move
Mm.
around and look at the bottom of your foot and make sure it's in good shape. And if you can't do that, then have a caregiver help you out. It's okay. Ask your friend. So just some little tips.
Awesome, awesome. Did anyone want to share anything else around that
Yeah, I had a
subject?
patient. Yeah, around the feet. I know. A hot topic for sure. We had a patient who was out and washing their car and in their sandals, ended up with a blister and thought it had healed. It only healed on the outside, but it did not heal on the inside. And
Oh.
so it became infected, and
Mhm.
ended up having to go to the wound care clinic for years to try and get this wound healed. So something small like that, that one decision that led to the blister, it can really add up from there. We get consulted to go talk with patients in the hospital for diabetes education, and that is a lot of the consults we receive are from patients who have a foot wound or ulcer, and unfortunately, when it gets so infected, it can go to the bone. And that's where those amputations happen. So we really, like what
Mm.
Brandy said, check your feet, not just to make sure that they're there, but to make sure you don't have any cuts, ulcers, sores, bruises, anything like that. If there's anything out of the norm, then let your provider know and to get that treatment as fast as you can. Absolutely.
Awesome, awesome. And no old home remedies.
No,
Know
don't
what your
take that
provider
little
gives you.
and that little pet egg that you take to scratch your feet.
Oh,
Do not do that.
good point, good
Um,
point.
A lot
yeah,
of bad advice on the internet
nothing
these
like that.
days.
Yeah, no cheese grater to the feet.
Right. And one thing I'll throw in there too for reality is the providers don't oftentimes ask you to take your shoes off. And when
Yeah.
I worked, when I did clinic visits, I would actually go into appointments with patients. So I got to kind of see how those visits go. And, they'll have a sign on the door that says, if you have diabetes, let us know so we check your feet. Nobody says anything. The doctor, provider doesn't say anything, and we leave with our shoes on. So I
Yeah.
would always encourage our patients to just when you go in, take your shoes off. If they don't have you disrobe for the visit, which a lot of times they won't, if it's just a follow up, just go ahead and take your shoes off and make them look. because they need to look. You're supposed to have it annually, but you want to get
Yeah.
on that on top of that as quickly as possible. If you did step on something and didn't feel it, you need to know that.
And
So
on
just
Yeah.
that note,
take your shoes off. Just
yeah,
flat out
on
take your
that
shoes
note,
off.
Tom, they should be
Take your
not just
flip-flops off
looking.
when you get there.
Yeah, they should not just be looking, but they should also be checking for sensation in your feet. That's really
Yeah.
important. As your diabetes progresses, some people can develop what's called neuropathy, and so that's damage to the nerves in the feet, and it can lessen their ability to feel things. And so we want the providers to definitely be totally checking the feet, not just like Carly said, "Yep, they're there." Yes, they're there. Can you feel them? And do you have any redness or any areas of concern?
I think that's so important what you are all saying, especially in reference to that self-advocacy, right? Because again, some of this stuff is like, oh, people don't want to check my feet out or whatever myths or stigma is related to some of these things that we're talking about. It's so important that you remember your health is important and whatever you have to do to advocate for your health, do it. Don't feel ashamed about it. Don't feel like you're going to make somebody uncomfortable. Your provider's there to protect you, to take care of you, to work with you, as everyone's been saying. So make sure you mention those. And if they don't come up, go ahead and do what they're saying with you be assertive enough to do the steps so that you're already making sure that those things are happening for you. I love that. So I'm going to stop right here because we touched on a lot of information. I want to shift a little bit to what folks are saying in the chat and kind of answer some of those things that maybe have come up throughout our conversation. I continue to encourage you, go ahead and put any questions you have in the chat or in the Q&A for us to answer while we have you with us. So, Lindsay, I'm going to go to you, and if you can tell me if there's any questions for our panel from the chat or the Q&A, excuse me.
Okay, thank you, Kelsey. What a great panel discussion. It looks like we do have one question over in our chat.
Okay.
And the question is someone who had gestational diabetes more likely to get diabetes later in life?
Good question. What do you guys say? Anybody can start.
Yeah, I think it's at 50%, like a 1 in 2 for patients who have had gestational to develop type 2 diabetes within about the next 10 years or so. So very high prevalence. And that's why it's important working on those factors. Hopefully you met with a dietitian while you were pregnant or whoever you're speaking about and learned about those carbohydrate foods and portions and the importance of exercise. So really working on those lifestyle changes to try and prevent that risk.
Awesome, awesome. All right. Anything else?
Yes. Do people with diabetes always have to take insulin?
I'll take that one. No, the answer to that is no, that's not always the case. It used to be that's when people decided if they were, really diabetic. If I just take pills, if I'm just on exercise, if I'm on diet, I don't really have diabetes yet. It's when I go to insulin. That's the definition of diabetes. And we talked about this earlier. That's not true either. There are plenty of people that have had diabetes for years that have never had to take insulin. Their bodies are making enough still to control their blood sugars with probably some help from pills and a better, exercise diet routine. Most of the pills, we didn't have time to get into all this. I know there's probably a whole session we could do on
Yeah.
herbs and supplements. People love to take herbs and supplements for diabetes. That's the question I get the most as a pharmacist. But the pills that we have on the market, one of them, one class helps your pancreas make insulin. And so those are the older versions. Don't use them that much anymore. Some of the newer ones, though, help our bodies get rid of blood sugar through our urine. So, one class in particular helps our body with the GLP. I know everybody's heard about Ozempic and Mounjaro, Zepbound, and Wegovy. The Zepbound Wegovy really is for weight more than diabetes, but that class of drugs is really popular right now. Those
Right.
are injectables, but they help our body. They replace an enzyme that our body doesn't make enough of, our hormone that our body doesn't make enough of, that helps us with our diet, helps us control our sugars. So not a magic pill, but it certainly does a good job. And so people can take that, not ever having taken insulin, although that's a shot as well. So can't say that you'll never have to take insulin, but there's certainly some things that you can do to help prevent that progression.
Awesome, awesome. And it's the balance, right? The
It
nutrition
is,
with
and
the
again, it's
medication and all of it.
and let me emphasize again, going on insulin is not failure. It's not like you're failing your therapy. It may be a natural progression of your pancreas is not making enough insulin. Now you have to supplement, even though you're doing everything right. So you should
Mhm.
never look at taking insulin as a punishment. It's just a piece of the process.
Right, right. All right, and we're getting close to the end here with time, so we might linger a little bit longer because we want to share some tips with you all. I'm going to go
Mhm.
ahead and go to our panel and let them share some tips first of what things people should kind of be aware of, what to take with them. I have some slides also that we're going to pull up to share with you all. We'll go over the survey also, pull that up in a sec. So bear with us 5 more minutes. We definitely had some great discussions and wanted to make sure that we touched on your questions as well. I'll go ahead and start with Brandy. What tip do you have to send off folks with?
So my tip is, did everyone know that Partners has a chronic condition management of diabetes program? So we do offer a chronic condition management diabetes program for our Tailored Plan members. So you can sign up or refer yourself through the website, which is a great opportunity. And you will be reached out to by a health coach for weekly sessions, and education's provided, and it's everything from all the things we talked about today to your exercise plan to your creating your plate to your skin. So it's all of it setting your goals. So I encourage you, if you or a loved one or a member that you serve is interested, sign up, do the referral, and we'll see if you're eligible and get you in the program.
Awesome, awesome. Thank you so much. And Tim's been putting a bunch of links and things to our
Awesome.
health library and all that stuff that we have available. And Carly, I know you all have stuff available. So what's your tip for folks
Yeah.
as we work collaboratively to support our members and our patients and our community?
Absolutely. And that's what we have here at Atrium Health Stanley as well. It's a 10-hour program for our classes. So we meet with you one-on-one first, just to get to know you better. And then our group class series is 2 hours in the morning, afternoon, or evening. We have any of those times available. Usually the classes are offered every other month. We have 8 hours in those classes and then a 1 hour follow-up 3 months later. We do have a lab here at the office where we can collect A1C. And lipids, and we help you compare that from your very first appointment you had with us to the last. We've had some amazing results with patients. I was sharing one this morning. A patient came in from the hospital. We had referred him, and he was a 14.2 for his A1C, and it came down to 6.6. And that was after going through the classes and really taking taking care of himself, really.
Mm-hmm.
And having that information. So I like to think of it as a three-prong approach: diet, and that just means trying to do the best with our food choices, our exercise or intentional movement, and then medication if that's what's needed for us as well. So really working on all of those pieces of the puzzle together, and what you mentioned before about being an advocate for yourself, definitely. And then if it's for your partner, your caregiver, whoever, to have that support team.
Awesome,
Yeah.
awesome. Thank you so much. And
Mhm.
I'm going to turn to Tom. What is your tip? I know, again, that collaboration and that support that we need, right?
Yeah,
But
absolutely.
what do you have to share
It's
with us?
hard for me to know which tip to share, but I'll try to say a bunch of them in a short period of time. But the
Hmm.
biggest one, I'll just agree with wholeheartedly with everything Brandy and Carly said, and kind of
Hmm.
summarize that by just be good to yourself. Take care of yourself. Do what's right for you. Find those things and those people in your life that make a difference to help you make those changes that you need to make. And then when you don't make them the way you want to make them and they don't work out the way you want them to, be kind to yourself. Don't beat yourself up, because the stress, as I like to tell everybody, the stress you're causing yourself because you're not meeting your goal is causing your goal to get
Right.
worse, not better. So be kind to yourself. Don't beat yourself up when you have bad days. Eat a piece of cake without guilt. And the person that says you can't have that, say, watch this. Watch me eat this. But again, it's all about moderation. It's all about
Moderation,
doing
right,
part of the plan.
right.
And let me give you a couple of things to consider to help you. There's actually a statewide website, and I had to look it up because I say it wrong every time. But it's Eat Smart, Move More NC.
Mm-hmm.
EatSmartMoveMoreNC.com.
Mm-hmm.
A lot
Mm-hmm.
of tools on there. The state of North Carolina is very eager to help us as residents of North Carolina take better care of ourselves. So that's a nice place to find resources to help you eat better, move more, all those things. The other thing I would encourage you to look for is a program near you called the Diabetes Prevention Program. It came from a huge study years ago, and the CDC kind of put it together into a package, totally free. It's available on the internet. You can access the training materials. It's a workbook, and there's a bunch of material in there. And in our classes, we had to trim them down to 8 weeks, so we only hit the big topics. But a local YMCA near you probably has those. A lot of the community-wide program use that information from that program, but it's called the Diabetes Prevention Program, really funded by the CDC. But
Yeah.
again, all the workbook, there's a teacher's version of the workbook with the notes. All that's available online for free. So dig into that, and if you need help, find somebody that can help you dig into that and then apply it. Because a lot of times it's
Absolutely.
not necessarily what we need to know new stuff. It's just the encouragement to do the stuff that we already know. So surround yourself with positive people.
Awesome, awesome. Thank you all so much for being with us. I'm gonna ask Terry to pull up some of our end portion of our training here or session. Thank you again for our panelists who have a plethora of knowledge, and an hour was too short of a time. We were really, really getting some good stuff in there. Again, some of those management tips that we already heard from them, check your glucose or your blood sugar, I should say, often. Your medicine is important, right? Eating healthy is super important. And staying active, and make sure that you get enough sleep, your stress level, um, eating and drinking plenty of water. Brandy was mentioning that, and I think Carly as well, substituting those sweet drinks for plenty of water. And make sure you're getting those doctor's visits in. And hey, keep a diabetes journal so you can see what your progression looks like or what things you need to tweak, as we were talking about. Each one of us need a particular type of recipe for what we need to stay healthy. So ask for help and practice self-advocacy. Super important. Ask for help and use your resources in your community. Please be connected with us, and I'm going to share with you the way that you can do that. We do have a link to our population health survey. So Tim is going to drop that in the chat so you can take that later on. We want to know how we can support you better. And then there's going to be a QR code for our survey so you can let us know more about what topics you want us to talk about and what more you need to know. As well as here's a way to contact us here at Partners for us to connect with you. There are also diabetes trainings on our community engagement department as well as our member engagement department. So if you need more information, there are some virtual trainings that we hold here at Partners for our members. If you need to call us, our member and recipient line is right here at 888-235-4673. If you need to contact any of our provider services, line is 877-398-4145. Our pharmacy is available at 866-453-7196. Our nurse advised line, as Brandy was saying, is available at 888-369-2452. If you need non-emergency medical transportation, 833-577-2309. And our behavioral health crisis line is always available 24/7 at 833-353-2093. If you have any questions, reach out to us through member questions at Partners Behavioral Health or BHM Our teledoc is available as well at 800-835. And please stay connected. Scan the QR code. We're here to serve you. We're here to collaborate with you in your health journey. Again, panelists and our support staff, thank you so much for being with us today. Please take care of yourself. Enjoy the beautiful sunlight and spring coming up now. So, daylight savings, we love that. Thank you all for being with us. We're going to say bye and join us next month for our member cafe. And take care, everyone.